Hello, my name is Amy Lee Reese. Welcome to Ostomy Academy. I'll be your host this evening, and on behalf of United Ostomy Associations of America, I want to welcome you and thank you for joining us tonight. I see that some of you have already told us where you're coming in from, and we would love to see where you're joining from if you want to write that in the chat. And as we go throughout the program tonight, if you have questions or comments that you'd like to put in the chat, go ahead and do that. We'll definitely save some time at the end that our speaker can answer questions and respond to any comments. So thank you so much again for being here. Ostomy Academy is a free online educational seminar series to bring trusted and comprehensive ostomy information to all members of the ostomy community. Throughout the year, we'll have top experts, medical professionals, and experienced ostomates who will share and focus new series of quality of life concerns in each presentation. Stay tuned for announcements on upcoming programs. So we will have throughout the year. Recordings of these programs and past Ostomy Academy presentations can be found on UOAA's website. And we'll put the link in the chat so you guys can go back and watch some previous programs if you'd like. UOAA's ongoing commitment to ostomy education is extremely important to me. Personally, I'm living with an ileostomy, a permanent ileostomy from indeterminate colitis, and I know that it's crucial to me as an empowered ostomate to have this knowledge and up-to-date information so that I can have the best quality of life that I can living with my ostomy. That's one of the reasons why I support and I volunteer for UOAA. With that being said, I'd like to invite you all to another unique education opportunity to learn and meet hundreds of other ostomates at UOAA's 2023 National Conference. This will be the first conference since 2019, and it will be held in Houston, Texas in August, the 10th through the 12th. The conference will feature a free stoma clinic, a large exhibit hall to discover lots of new ostomy products. There will be fun social events and dancing, an interactive educational session from top experts, and special tracks for young adults, caregivers, IBD patients, and young children and their families, to name a few. So we will put that link also in the chat if you want to check out information on our conference and even a registration link. I know I'll be there in August. I hope to see all of you as well. But tonight, I'm really excited to be here with you learning at Ostomy Academy. And our program is amazing. You're going to learn so much. This is a topic for all ostomates. So whether you're joining us as a new ostomate who just had surgery and you're learning how to move your body again after surgery, or an experienced ostomate that has a little bit of a need for additional tips and exercises, this program is aimed at helping you feel more confident with life with an ostomy. Our discussion will focus on 4 foundational topics to be addressed while recovering from ostomy surgery. We'll also discuss the benefits of physical and occupational therapists and how working with a therapist can help you recover from your surgery. I'd like to introduce our Ostomy Academy speaker for the evening. Her name is Charlotte Foley. Charlotte, welcome.
Hi, Amy. Yeah, no, thank you all so much for having me on tonight. I'm excited to chat about this topic.
Thank you so much for being here. We really appreciate it. Charlotte has a degree in occupational therapy and started her work in the adult inpatient rehabilitation setting. She now works at the adult care setting in Anchorage, Alaska. Because of her own personal experience living with an ileostomy and her professional experience, she founded and runs her own education and consulting business, Restorative Ostomy Solutions, to empower individuals in their recovery from ostomy surgery. United Ostomy Associations of America is so proud to host tonight's Ostomy Academy program, Foundations for Recovering from Ostomy Surgery. Charlotte, the floor is yours.
All right, thanks, Amy, again. Yeah, so hello, and thank you all for joining, and especially to the United Ostomy Association for the opportunity to speak with you today. I feel very honored to be able to speak with you on this topic that is really incredibly important for anyone going through abdominal surgery and especially ostomy surgery. As the title tonight states, we're going to be talking about the foundations for recovering from ostomy surgery. And I want to start the program off tonight by just discussing what these foundations are and why they're important for surgery recovery. And I think a good way to start talking about these foundations is just looking at surgery recovery as a whole. And in my line of work, I work not only with folks recovering from abdominal surgeries, but all sorts of illnesses and disabilities and different types of surgeries. And for many surgical procedures, there are protocols to follow, very outlined ways to rehabilitate and move on from surgery. And with abdominal surgery and ostomy surgery, there tends to be a huge gap in, being in the hospital and undergoing surgery to then what? Like, how do you start moving your body again? And so tonight, I want to chat about the areas that can really provide more structure to ostomy surgery recovery. Because my goal is really that any person undergoing ostomy surgery will have the level of care that others undergoing other surgeries are able to have after surgery. And there are a variety of tools and exercises that can really help you in your recovery from surgery and managing your ostomy in day-to-day life. So we'll be kind of chatting about a whole host of things that you can do to set yourself up for success after surgery. All right. And to start things off, I want to give a little background about myself. I know Amy Lee already provided you with a little bit of my bio, but I want to give more of an introduction about me and why I'm passionate about this area. As you can see here, I am an occupational therapist. I identify as an ostomate because I live with an ileostomy, and I also identify as an athlete. And all of these areas that I identify with intersect. I'm primarily going to be talking to you tonight from my background as an occupational therapist. But the other personal aspects of myself definitely come into play with this topic. And for those who are like, well, what is an occupational therapist? I've heard the term, but don't exactly know, how an occupational therapist can work with those after ostomy surgery. I'll give a little definition to start with. So I am an occupational therapist in the hospital setting. So I am working with folks right after surgery and illness, like I said. And occupational therapists are professionals who help people across the lifespan to do the things that they want and need to do. So there's OTs like myself working in the hospital, there's OTs working in the community with children, adults. We really cover a broad variety of categories. And so in the hospital setting, we're specifically working with different folks on returning to their activities after illness and disability. And so I have a chance to support many individuals going through surgery, especially in the very early days post-op. So I will see patients the day they have surgery, the day after, and follow them through their hospitalization. And this can include anything from focusing on daily self-care, so working with my patients on learning to get dressed again, use the restroom, shower, to more complicated tasks like how do you do laundry or get out and go start building up your exercise routine again. We really focus on strengthening and learning new habits and routines to help support getting back to daily activity. And to give a little more specific example of how an OT could work with someone who's gone through ostomy surgery, I'll just run through an example of my own. So in the hospital setting, like I said, I'm working with a variety of folks. And I had a patient once who had been through surgery maybe a month or so actually before I was seeing them. And they just kept having leaks with their ostomy bag and they couldn't figure out why. They'd been working with their wound ostomy nurse. And what I found was that whenever we'd be getting up and moving and starting to do activity, that's when the leaks were occurring. And so I was able to collaborate with our wound ostomy nurse on products that would work for this particular individual in the ways that they were moving their body. So OT is a really collaborative discipline. We love working with the whole team in the hospital, and it's a really fun profession to be in. Outside of my hospital work, I'm also the owner of an education and consulting business, as Amy Lee mentioned. And my work focuses on helping people in the early stages of their recovery once they leave the hospital. So just providing a little bit more support once they get back home. So that kind of being said about my professional journey, I also feel that it's important to share a bit about my personal story because I can sympathize with what it's like to have just gone through ostomy surgery and looking at how to return to life after surgery. So in my personal life, my ostomy journey began back in 2007 when I had my first temporary ostomy while I was undergoing J-pouch surgery. And I have to say that I did not like having an ostomy at the time. I had a terrible time with it. I was constantly having leaks. And it wasn't necessarily that that I was having trouble with the concept of having an ostomy. It was more the impact on my daily life. I was used to being an athlete and I felt like I couldn't participate in my sports. I just didn't have any guidance on how to return to the activities that I enjoyed while going through these surgical procedures. And since my temporary ostomy, I then, like I said, had the J pouch that ended up failing. And then I underwent my permanent ostomy surgery in 2013. And I now have a permanent ileostomy. And I've had multiple stoma revisions since then. So I have a lot of personal experience recovering from surgery. And after joining the rehabilitation field, I've been able to combine those personal experiences with my work in the hospital to really develop programs and protocols to get people back to moving and feeling comfortable in their bodies again and healing their bodies in a safe way so that they can do what they enjoy. So now that I have my ostomy, I really work hard to enjoy life and not let it stop me from what I want to do. This leads into my identification as an athlete. So I'm passionate about the outdoors and adventure, whether it's skiing or hiking in the mountains or traveling the world. There's some pictures here from me getting out and enjoying the outdoors. And being able to experience life again and feel really happy in my life has really made me more passionate about helping others and helping others identify with what is meaningful to them and learning what it means to live a full life with an ostomy. And that's what I want to come across today as we go through these next slides. I want you to take this information and feel that you can run with it to be able to feel confident in what you're doing every day. So, what are the foundations for recovery? In my years of working with my clients, as I said, I've come to recognize a few topics that are often not the focus of early education in the hospital after surgery, but that really should have more of a focus. And of course, I don't want to discount the education that's received from ostomy nurses and learning to manage an ostomy that is invaluable in the early days of surgery. But as an OT, it's my job to help my clients get back to their daily lives and thriving with their ostomies. And that begins with setting a strong physical foundation and discussing these topics that are often forgotten. So today we're going to be discussing the topics of breath work, early mobilization, core recovery, and lifestyle management. And these 4 categories are ones that I've identified that provide a nice balance for the body and can help set you up for success on getting back to your day-to-day life. And so we'll be going through those one by one tonight. I'm really going to be highlighting the breath work and core recovery topics a bit more because I know those are ones that often there are more questions about. So as I said, category number 1 is breath work. And I love talking about this topic. I could spend an entire hour talking about this topic only. I have trained myself and my clients to think about their breath in every activity that they're doing. And it's really interesting to see the impact of surgery and surgical procedures on breathing. And it's an important topic because it focuses on a lot of areas of concern after surgery. So, breath work can help us relax. It can change our stress hormones in that way to help us relax. In the hospital environment, in particular, it can really help prevent postoperative pneumonia, which can be pretty high in abdominal surgery. It can help us coordinate our disrupted abdominal muscles from our incisions and everything. It can increase our oxygen, which helps us with healing and tissue repair. It can improve coordination of our diaphragm, which is a really important muscle that we'll get to a little bit later, and then our abdomen, back, and pelvic floor. Breath work can help us regulate our intra-abdominal pressure, which is the amount of pressure that we have in our abdomen. And if done properly, using that breath can help decrease the risk of hernia or stoma prolapse, big concerns after surgery, and can also help decrease back pain or pelvic pain. And through our breath, we can really target these goals that I have listed on this slide here. We can, like I said, improve management of our intra-abdominal pressure, which is very important, strengthen and coordinate our core muscles, because who doesn't want a strong core after abdominal surgery? And then improve cardiopulmonary function to allow for improved participation in daily activity. So, to learn more about how breath can change and what we can do after surgery, I want to start by talking about what is considered a normal breath. So, when we talk about breathing, it's really easy to just think of air coming into our lungs and air going out of our lungs and be like, okay, I breathe every day. It's pretty simple. But what really happens when we breathe in is that air enters our lungs, and that causes our diaphragm to expand, which causes then our abs to move outward and our pelvic floor to move down. And then when we breathe out, everything recoils back up. So, what this means for us is that breathing is the first exercise that you can begin after your surgery to start improving the range of motion and strength of your deep core muscles, which includes your abdominal muscles that have just been impacted by surgery. And this is important because the stronger the core, the decreased risk for injury, like I said. Strength isn't the only factor. We really want to make sure that we're protecting ourselves after surgery. And if we learn to manage breath, particularly with strenuous exercise, we can better manage that pressure in our abdomen. So, a good example is if you go to stand up or pick up a heavy weight after surgery while holding your breath, that pressure will really build until it finds a weak area, like near the stoma or at an incision, and that can lead to injury. But if you're managing your breath and exhaling properly, you can really decrease that pressure and have a less likelihood of developing an injury. And so these coordinated movements through the use of breath can be really valuable. All right, to take that further, and I want to make sure this is applicable and give you tools you can actually use. I want to start by just going through a check-in with you on your breathing. So I want you all to place one hand on your chest and then one hand on your abdomen and just breathe normally. And as you're breathing, I want you to think about where you feel your breath. Are you feeling it more strongly in your chest, or are you feeling it more strongly in your abdomen? For a long time, I was more of a chest breather. And this is because of my abdominal pain and my surgery. I was constantly clenching my abdomen, which meant my abs were really tight. And so my chest was the only part of my body that could really move properly. And this ended up causing me pain and discomfort. And so, working on some exercises, I started focusing on getting more breath and expansion into my abdomen so that I could allow those abdominal muscles to really lengthen. and move through their full range of motion so that I could be healthier and move in a healthier way. And now I find that overall, I actually, when I hold my hands on my chest and my abdomen, I'm breathing more evenly between both. And everyone's a little different. So even prior to surgery, you may have had one way that you were breathing more than the other. And it's not something that's problematic necessarily or going to cause issues. It's just something to be aware of, especially after surgery. If you're finding that you're really breathing into your chest more and having a hard time expanding your abdomen, you can end up with more tension in your shoulders and your neck. So just trying to find that right balance between the two. And it's, you can just look at these small changes that you can make. So not, forcing yourself to breathe one way or the other necessarily, but small changes through exercise can really help your deep core function optimally. And that's something we can look at in this next exercise. So we're going to go through an exercise called 360-degree breathing. And other than just talking about breath, this is really the first exercise that I teach every single person that I'm working with. It's a way of breathing that really activates your entire deep core, which I keep chatting about, but we'll get to in a little bit. It allows your deep core to move in a coordinated, controlled manner to help decrease pain, improve mobility of your tissues, and assist with digestion, just to name a few benefits. So I'm going to show you a video here, and then we'll talk through the exercise. And this video is very subtle, so you're really going to have to look closely to see the movement. All right, quick video there, but that's me working on what we call this 360-degree breathing. And I want to talk through the steps of what I was doing so that you can take this and start working on it on your own. And I was laying down in that video. You can lay down, you can sit, you can stand, wherever you're comfortable is how I want you to do this exercise. So to start this, you're going to be placing your hands on your lower rib cage, like you saw in the video, where your rib cage meets your abdomen. And I want you to take, when you do this exercise, you're going to do a deep breath in through your nose to a count of about 5. And while you're inhaling, you want to think about letting the air fill up your abdomen like a balloon. Obviously, the air is just going into your lungs, but I want you to imagine that your body is filling up like a balloon so that you're expanding all the way around your body, not just into your abdomen or your chest. So you really want to think about breathing into your abdomen, your sides, and even into your back. And then after you've expanded out, you're going to exhale out through pursed lips like you're blowing out candles on a cake. And you're going to do this for 7 seconds, so a little bit longer than the inhale. So it'll just be like this. And then you'll repeat. So you can repeat that exercise about 10 times, a few times throughout the day. And none of this should be forced. So like I said in that video, is very gentle and subtle. You don't want to be rapidly pushing your breath out or inhaling really quickly because that can also cause injury to your abdomen if not done properly. So just gentle and subtle, really focusing on expanding and then letting everything go. And this is just a simple breathing exercise that you can do, but it gives a whole host of benefits, like I mentioned. So if you're worried about what type of core exercises to be doing or how you can start, this one is an easy way to just start today. And as I said, I could continue talking about this topic, but I just want you to get started with that one exercise and see how it feels. So we're going to move on to our next foundational topic. So next we have early mobility. And as an OT working in the hospital, I am hard set on early mobility. I like to get my patients up and moving. Like I said, even start working with them the day they have surgery, if possible. We always have to make sure that the surgeon gives the go ahead, but if they do, we are up and moving. Early mobility touches on how you're moving your whole body after surgery. It's one of the most important things you can do to set yourself up for success in the future. So, whether you're starting to walk after surgery or you're a wheelchair user, it's really important to get yourself moving. So, the benefits here are things like spending decreased time spent in the hospital through mobility. Mobility can strengthen joints and muscles, helps strengthen and coordinate our abdominal muscles, helps with digestion, helps with blood flow and preventing blood clots, decreases risk for pressure sores. And the goals that I typically identify with my patients are, like I said, to start moving day of surgery, utilize purposeful movement, and focus on posture. So we'll touch on those briefly. So purposeful movement, again, just like breathing, it's easy to breathe. It's easy to think about just getting up and moving. But this purposeful movement is really thinking about how you're moving and what you're doing when you move after surgery. So this can be anything from thinking about how you're getting out of bed, how you're sitting and standing up from the toilet, how you're getting in and out of a car. Um, a lot of the mobility I talk about after ostomy surgery is ways to move your body while decreasing the amount of strain on your abdomen. So I really start with how to get out of bed and use breath to decrease that strain on the incision or stoma. And so this incorporates the breathing and mobility piece. So anytime that you're doing something exerting, like trying to sit up out of bed or stand up, doing an exhale with that movement can decrease that pressure and decrease the strain on the abdomen. There's actually been some interesting studies done looking at pressure in the abdomen and looking at like planks and sit-ups and sitting and standing and how much pressure there is at a time. And it's surprising, I don't have the number on the top of my head, but it's surprising how much pressure is created in the abdomen with that sitting and standing. So just really important to make sure that you're not feeling that strain when you're moving. And like I said, early mobility really is the key in the hospital setting. If there is a therapist or a nurse or someone that can help you focus on proper technique, that's going to be really important. And then if you're somebody who's out of the hospital and back home already, just looking at increasing your daily activity. So typically I'll recommend, well, I always assess my clients individually, but if they do better with like a time frame versus steps. So usually I say start with like a 5-minute walk and then add 5 minutes from there. If you're someone who has a tracker on your phone or your watch, I'll usually say start with 1,000 steps and then add 500 steps each time you go on a walk or mobilizing yourself. And posture is also really important to pay attention to when getting up and moving after surgery. So it's really easy to feel like hunched over, that your ostomy bag's pulling you down. But really thinking about tall thoughts after surgery can help, not only for posture, but to save you from back pain down the road or other orthopedic conditions. It can also help lengthen your abdominal muscles and prevent tightening. So that will really be helpful. And one tip that I always talk about with my patients is to find a tool that can be helpful, whether it's someone watching your posture as you're moving around or using hiking poles or something like that, that just helps you stand up straighter and provides a little bit more support. Um, a lot of time in the hospital, people will be pushing IV poles around, and that's more like one-sided. So if you can have hiking poles and have something to hold on to on both sides, that's really better. And so, yeah, that was just kind of a quick overview of early mobility. There's a lot more we get into as therapists, but just important things to be thinking about. All right, so topic number 3 is core recovery, and this is the big one. There's always questions about strengthening your core again after surgery and what you can be doing. And it's interesting. I know Coloplast has done some research, and if you've heard of Sarah Russell, who's an exercise specialist out of the UK, she's done a lot of research on this topic. And all of this research really demonstrates some big gaps in the discussion regarding core recovery and strengthening after surgery. Some of the statistics on this include that 44 to 62% of individuals are less active after ostomy surgery than they were before surgery. 82% of individuals were not given advice about abdominal exercises that they could be doing. And 90% of individuals with ostomies do not meet guidelines for physical activity after their surgery. So guidelines that are set for national standards. And that is really what I want to change today. And like I said, if breathing can start strengthening your core and daily mobility gets you moving, then you really can start your exercise routine today. It does not have to be complicated. And this is super important. Strengthening and coordinating your core is often at the forefront of people's minds when they undergo surgery, like we talked about. It can be really scary to think about because there are horror stories out there about hernias and prolapsomas and all sorts of different complications that can occur because of exercising incorrectly or not receiving the correct education. But despite the statistics and all the stories and myths surrounding exercise after surgery, research actually recommends beginning core exercises 3 to 4 days out from surgery, and there is information out there and available to you. And like I said, I'm not talking about starting off with like sit-ups or planks or things that are going to put a lot of strain on your abdomen right away, but gentle exercises that will go through like pelvic tilts and knee drops. Exercises that really help engage your deep core and will allow you to have greater control of your core muscles. And that will give you strength back in your body and will improve your mobility and soft tissues to help you get moving better. So your core is your foundation. And if your core isn't strong, nothing else will follow. And I kept talking about your deep core. And so this is where I really want to focus on that. So in order to progress to more challenging exercises, you want to make sure that you've prepared your body appropriately so that you can build back into your routines. So I'm going to start with a little anatomy lesson because a huge part of my job is self-empowerment for my patients. And I feel like there is nothing more empowering than learning more about our bodies and how to move them in a better way. So if you aren't familiar, the deep core is actually made up of 4 sets of muscles. And oftentimes when we think about our core or our abdominal muscles, we're just thinking about like our 6-pack abs, which is called our rectus abdominis. But that's not even part of our deep core. So these 4 groups of muscles that I'm going to talk about are really some of the most important muscles for building our foundation so that we can then start to strengthen our other abdominal muscles and larger muscle groups of our bodies. So these 4 muscles include the transverse abdominis, which you can see in the upper left corner. So that's like a big corset that wraps around the abdomen. It's a deep layer of our abdominal muscles. Then we have the diaphragm, which we talked about with breathing. This is a major muscle of respiration. The multifidus are muscles along the spine that stabilize the vertebrae as the spine moves, and these muscles are active in almost any activity that we're doing that's against gravity. And finally, the pelvic floor muscles. So these are actually a group, if you ask, there's different numbers, but based on the categorization, but anywhere from 14 to 16 muscles in our pelvic floor that create a sling across the floor of the pelvis. And they help to hold our pelvic organs in place, like our bladder. They can, and when they function correctly, they really provide that nice support. So these are extremely important muscles, and they're often forgotten about after abdominal surgery. So there you have it. These are the deep core muscles, and these should really be the focus of progressive strengthening or mobility after surgery. Because like I said, we have to build that foundation to decrease our risk for injury down the road. So sometimes the exercises I'm going through will seem very simple, or you may not feel that you're getting a lot of benefit out of it because you don't have that like strong sore feeling after exercising, or you don't feel like you did a lot of work, but really setting this foundation is very important. And now I want to go into a few examples of these exercises that you can begin. I do tend to have difficulty going over specific strengthening and coordination exercises in larger formats because I'm very used to working with individuals, and every individual really is unique. So I highly recommend that if you are beginning to strengthen your core again after surgery, that you really reach out to your medical team and a professional who can evaluate you and how you're moving. And one example of this is like I personally have had a back injury in the past. And so in my mind, I'm like, okay, I have to keep my body moving and I need to make sure I'm stretching. Um, and so if I look up exercises on how to stretch and work my back, I can find all sorts of things on the internet. But when I actually talk to my physical therapist that I go see, we're able to really hone in on what exercises are beneficial for me. So the same stretches that may work for someone else don't work for me. So I do think it's really important. You can take these exercises as foundation to start with, but really working with someone who can dedicate their time to looking at you and your needs is going to be really important. So today we're going to be talking about 3 exercises to begin with to strengthen your core. And these include pelvic tilts, modified bow and arrow, and single knee dropout. So I'm going to pull up a video. In the video, I'll do a brief explanation of the exercise, and then I'll kind of walk you through that exercise. So we're going to start with pelvic tilts.
Pelvic tilts. Pelvic tilts will teach you to engage your abs so that you aren't compensating and making up for the fact that they're not working as well as they should be. So to start pelvic tilts, you're going to lie down on your back. And when you do a pelvic tilt, you're tilting your pelvis. So you're rounding your back down and drawing your belly button in. And you're bringing your hips up towards your ribs. So you'll lie on your back, bring your knees up into a comfortable position, and I'm going to relax my back. I'm almost going to try to press my back into the ground as if I'm squishing a grape. I want to leave a little bit of a space, but try to press it down. And then I'm going to round back and tilt my hips towards my ribs. And then I'm going to relax and let my pelvis rotate towards my feet. So back towards my ribs, pulling my belly button down, and then relaxing, tilting back towards my feet. And you don't want this to be a huge movement through your legs or rocking your hips, it's just slight back and forth. So I'm going to tilt back, pull my belly button in, try to squish that grape under my back, relax, tilt my pelvis down and away. Another way to do this if you're having trouble is thinking of putting a marble between your fingers and your thumbs. So you're going to be rocking that marble down towards your index fingers and back towards your thumbs. So if I place my hands on my lower abdomen, I'm going to tilt down towards my index fingers when I relax, and then I'm going to pull back, roll that marble back towards my thumbs. Down towards my fingers, back towards my thumbs. Good.
All right, so again, another very subtle exercise. And this one is one, like I said, you can work it out on your own, but it's also really helpful to have someone with eyes on and hands on to see how you're moving back and forth to help with strengthening. All right, next we're gonna pull up bow and arrow and go through that exercise.
The modified bow and arrow exercise is a great exercise to lead into more thoracic or upper trunk mobility down the road. When you're first starting out after surgery, we really want to avoid overly twisting so that you're not pulling on your incisions. So that's why we're going to modify it for now. So you're going to lie down on your side, and to ensure that you have proper spinal alignment, you're going to put a pillow between your legs, and then for comfort you can put one up by your head as well. And then you're going to bring your hips to a 90-degree position, or as close to that as you can get. You're going to bring your knees out to 90 degrees as well. And then you're going to lay your top hand on your bottom hand. And then you're going to slide your arm back over the bottom hand and out behind you. And then come back in. And while you're doing this, you want to make sure you're not rocking. You're going to engage your core. Keep your pelvis and your core really stable. So activate your core, then slide your arm out and back behind you. And then you're going to come back.
All right, so for that one, like I said, this is a modified technique. So if you're really in the early stages after surgery, just working on that rotation of your arm can be helpful. And then as you progress from surgery, you can start to really rotate your trunk a bit more. This is something I've talked with a colleague about, how we're finding a lot of folks after surgery, like I said, get really tight through their entire trunk and almost lose that rotation or that ability to rotate, I think, because we get really concerned about moving or just stiffen up. So it's really important to maintain that rotation as you go. We'll quickly look at single leg dropouts. And then I think for time's sake, we'll have to kind of keep plugging away at things.
Single leg dropouts activate your pelvic floor and your core, and they bring in the added challenge of your leg to challenge your pelvic stability. So for single leg dropouts, you're going to lie down on your back. Find your neutral spine position with your knees bent. Slowly, you're going to keep your core activated and let your knee drop out to the side. So you're going to start with one knee at a time. And then you're going to drop it out, and as you bring it back to center, you want to stay nice and controlled and make sure that you're activating. So you're going to drop out and back to center. And your opposite leg should stay nice and stable, so you don't want it to be wobbling out to the side. You don't want it to be trying to counterbalance you and your pelvis by bringing it out. So again, you're going to bring your one leg out to the side, keep your core engaged, your leg neutral, and then coming back in. Another
Sorry, I was muted there, but that's the single leg dropout. And like I was saying, that one's really about control and stability in your pelvis and your lower abdomen. So just like with the breathing and the mobility, how it's easy to just get up and move. For that exercise, it's really easy to just be like, oh, I dropped my leg out and I brought it back in. Pretty simple. But if you're really stabilizing, it can actually be pretty challenging to drop your leg out without letting the other one waver at all. So just something to think about, that really deep control is really important on that exercise. All right, so that is a very quick overview of some exercises you can start doing. There's definitely more to build off of, but those are some really good foundational tools that you can incorporate into your routine. And I myself even go back to those every now and then if I'm like, okay, I've been doing a lot of really hard exercise, but I want to do a check-in on where my deep core sits. And sometimes I'll find that even I struggle with those exercises if I haven't been working on them in a while. So even if you're years out from surgery, you can always benefit from coming back to these foundations. In addition to strengthening your core, you should also be making sure that all of your soft tissues are able to slide and glide properly, because the more that your tissues and muscles can move, the more activation that you'll have of your muscles and control of your core. There are a bunch of different manual therapy techniques that can be used to help our soft tissues. I don't have time to talk about all of those today, but I do want to briefly touch on scar massage because this is often another area that's forgotten. Because in the hospital, our incisions are too fresh, they're not healed enough to begin this. And so when we get to the point of actually being able to start this, we may not have that follow up with someone to go over it. So learning something like proper scar massage technique can be really helpful once incisions are healed. And the goal of core recovery, in addition to strengthening, is also to help us move in a way that doesn't feel restricted. And this scar massage can really help. So at about 3 months out from surgery, our tissues are at about 80% tensile strength, and remodeling of our tissues is at its peak. And tensile strength is the resistance of material to break under tension. So while we're not fully healed, we still have the ability to have damage or injury occur. The tissue at this point is really at a point that it can withstand gentle massage without injury. And it's actually really important to start scar massage before full healing or full tensile strength is reached. And that allows for improving range of motion, strength, and mobility in our tissues. So up on this slide, I have some examples of scar massage techniques. Again, this should be done in a gentle manner, but basically you can start just by getting used to touching your scars to allow for desensitization. So that's in number 1 there. And then you can work on just light pressure back and forth motion on your scar, up and down in number 3, doing gentle circles, and then working on actually kind of pinching that scar tissue and rolling it between your fingers. This is something that can be done years out from surgery too. There's new research constantly emerging that demonstrates the ability of our tissues to change over time. But this is something I would really chat with your provider about, because 3 months is somewhat of an indicator for being able to start this, but everyone, again, heals differently. You really want to make sure that you're at the appropriate stage of healing to begin scar massage. So that's a great question to reach out to a provider about. All right, and then that brings us to our 4th category tonight of lifestyle management. And this is a category that is really an OT topic. So lifestyle management is all about training your body on automatic movement patterns so that you can move around in your day-to-day life with your ostomy in a safe and efficient manner. It's a way of getting back to the activities that you enjoy. So the ultimate goal is that you'll be able to move your body so that you no longer feel like you're accommodating for your ostomy or nervous about doing something because you're worried that something will happen to your ostomy. So for example, if you go to pick up a basket of laundry, you've done your preparation, you've done your breath work, you know how to exhale, it's more automatic now, you've strengthened your core, and now you can pick up that basket of laundry without injuring yourself. Or if you want to go paddle a kayak, you've been doing your rotational movement exercise. So when you go to paddle the kayak, you don't feel stiff and sore the next day. Or if you are hiking, you've put in your steps every day to build up to a hike that's not going to completely exhaust you or make you start from scratch with your exercise. So really the goal here is to tie everything together that you've learned about breath work, mobility, and core exercise, and to implement those strategies into your day-to-day life. Because really, it's all about having fun and partaking in activities that you enjoy again without feeling limited by your ostomy. So my goals for my patients always include that my patients know how to manage their ostomies. And by no means am I stepping on the toes of wound ostomy continence nurses. We love to work in collaboration with our nurses. If I have a patient that the nurse has done their initial education on managing their ostomy, learning to change their appliance, then we take that information and start to put it into practice, into daily routines. One of my other goals is that my patients always have strategies to adapt to life with their ostomy, which I'll bring up in the next slide. And then the third is that they really get back to doing what they enjoy. And an example of this is I was working with someone who was really concerned that in his job, he needed to be able to pass a physical training test, and managing his ostomy he was required to lay on the ground during this physical training. And so he was really worried about how that would impact his ostomy, or if it would cause leaks, if he had ballooning. And so we just talked about ways that he could position his body so that he could really get back to that job that he enjoyed doing, because he thought that he was going to have to quit his job now that he had this surgery. But we were really able to talk through strategies so that he could go back to work eventually once he was healed. So on this slide, this is a tool that can be helpful when, and it checks off like multiple goals in our lifestyle management category, because it's a tool that I use to get back to activity. Like I said, if you put in all the work and set all the foundations to do the activities you want to do, you want to make sure that your ostomy is not getting in the way. So this is a very simple container that I use. I take it on camping trips, but basically this is a Costco pretzel container that I just put duct tape around for discretion. And I'll just put some kitty litter in a bag. I can empty my ostomy into that, throw it in the container, and move on with life for the day. I take this on road trips. You can kind of use it wherever I have different shape or size containers, depending on the activity that I'm doing. So like I said, lifestyle management is really getting creative and learning how to get back to life after you've set your foundations. So that was a lot of information. I want to talk about where you can actually start and the steps that you can take. My first advice is to take things slow. So check in with your body. Your body is your best guide at how to progress your activity. If you have pain, then you should modify what you're doing. If you're still having pain or having a challenge with what you're doing, then try something else. So it's always helpful to listen to your body. My next piece of advice is to set a goal. Goal setting is very important, whether your goal is to get up and down from the floor so that you can play with your new child, or if you want to just have the goal of walking around your neighborhood block. Goals are important because they guide what exercises we're doing. So my goal after every surgery is to be able to get back out and get skiing the next winter and get out into the mountains. So I select exercises that focus on single leg balance and rotational movements of my core. But you can really start anywhere. But goal setting is very important for that. And it's important to find support. So whether you're getting support from a support group, which I know the United Ostomy Association has a great search tool to find local support groups to you, or if you're meeting other folks with ostomies online, shared experiences can be invaluable. If I hadn't talked to other individuals going through ostomy surgery, I would not be where I am today. That being said, I also recommend, like I mentioned many times throughout tonight, to seek out guidance from professionals. There are folks out there like myself or other therapists and personal trainers who can help set up programs or routines to help you get moving more in functional ways and get back to your daily activities. And we're going to post some links in the chat. So if you're interested in finding a local therapist to work with, there'll be links up there. If you're looking for OT or PT to work with, I especially recommend seeking out a pelvic floor therapist or pelvic health therapist. These are both occupational and physical therapists who are especially trained to focus on the core and the pelvic floor, which are exactly the areas that need to be focused on after abdominal surgery. So just keep that in mind if you're doing a search. Pelvicrehab.com, which we'll have a link to, has a great search tool that you can use to find someone in your area. If you're just seeking out outpatient physical therapists in your area, the American Physical Therapy Association has a search program. And if you're looking for an occupational therapist, OT Potential is a website that also has a search tool you can use. And that being said, there is also the benefit of Google. Those search tools are not comprehensive, so they may be missing somebody in your community. So definitely do a Google search for therapists in your area, ask for referrals or references, look around and find someone that will fit for you. And don't hesitate to meet someone if you don't feel like what they're talking about is working for you. Then we can then just move on to finding another person that you can work with. There's no shame in kind of shopping around and finding the best fit. All right, and yeah, that is kind of the conclusion of that portion. I also want to share a bit about how I can support you. I have free resources on my website, restorativeostomysolutions.com, which I'll have a link to on the next page. And if you are someone who's had ostomy surgery or you're about to have ostomy surgery, I have a couple specific programs that I offer. One is a self-paced online program called the Ostomy Surgery Recovery Guide. So there's videos like similar to the ones that you saw today and a workbook that kind of structure your recovery. I also offer one-on-one surgery recovery education that includes that program, but also some individual meetings with me online. And then if you're a professional, a nurse, or another professional on here today, I also support other folks in the rehab industry or other areas of healthcare to best support their patients. So I've worked with quite a few facilities around to help set up programs and also do some professional consulting there. So there's many ways to reach out to me and get in touch. So we have time for Q&A, and up here is my contact information if you're needing to reach out or have any questions after the fact. And then I think Amy is gonna come back on and we'll go through any lingering questions.
Hey, Charlotte, thank you so much. That was so awesome. It was great, wonderful information to just really start small and slow. And, you know, it's great to hear about the breath work and how important that is. And 3 to 4 days after surgery, that is kind of mind blowing. But I get it that we don't want to be in that percentage, that huge percentage of people that are less active after ostomy surgery. So thank you so much. That's great information.
Absolutely. Yes. It's easy to get started, but needs sometimes some structure and guidance can be very helpful.
Very helpful. So let's get started on some questions that we have. Gina Marie says, if we have a hernia, will these foundation exercises help anything at all?
Yes. So if, you know, a lot of these I talk about and we think about prevention of things like hernias, but even if you are someone living with a hernia, it's still important to continue strengthening your core to help manage that hernia, to help things from developing further. Also, you know, exercise, learning to manage your breath is important if you're living with a hernia, so that if you're, you know, having an exacerbation in symptoms, you can use that exhale with activity to help. And then one thing that I didn't touch on it at all really is, you know, using some sort of abdominal binder or support is something that you can add in addition to the exercise to just help provide more support to your core. But absolutely, these foundational exercises can be very helpful after hernias.
Awesome. So Liz Heil says, can the exercises be done from a better couch if you aren't able to get up and down onto the floor?
Absolutely. Yeah, it is funny because in those videos, I'm on a yoga mat, and when I give my patients handouts, the person in the photo is often on a yoga mat, and they're like, "Oh, does a yoga mat come with my program?" And Like, no, it doesn't, but we start them in the bed, in the hospital bed, where I'm working. So they can be done anywhere. Sometimes being on a more solid surface can help you focus on that movement a little bit more because you can kind of feel how your back or your body's interacting with the floor. But if that is something that is challenging for you, you can still benefit from laying on a couch or bed or whatever is most accessible to you.
Good to know. Justin Blum says, as an ostomy recovering from surgery, would you recommend crunches and stay away from sit-ups?
I would recommend that if you are in the early stages of recovering from surgery, to stay away from those. That's not to say that you can't get back to doing those exercises down the road. It's just that you want to allow your body time to heal and set these foundations that we talked about before moving on to exercises like that. And those types of exercises really highlight where it can be very important or valuable to work with someone who's really watching your body mechanics or looking for signs that while you're doing those exercises that you might be pushing it too far. But yeah, there are absolutely people living with ostomies that do all sorts of exercises, including those. So I would just say in the early stages, especially the first 8 to 12 weeks, that those are something that you'd probably want to put on the sidelines and focus on the more foundational ones.
Like the ones that you showed us that focus more on the deep core muscles to make sure that you're kind of building the right way, the muscle strength.
Yeah.
Okay, very good. Connie Thompson, what is your opinion on planks? Is that an exercise best avoided or only when one has better abdominal strength?
So I'd give the same answer to the last question as I would to planks. So any of those exercises that are going to require a higher level of strength, I would say, again, not something to be avoided. Everyone's different. Personally, let's say after like my first 2 surgeries, I was able to get back to doing all of these exercises. Now I'm at a point where I can't do these exercises or they increase some of my other symptoms. So again, everyone's individualized. Some people may need to avoid planks, but some folks may be totally fine getting back to doing planks. But again, set that foundation, move on to it. And then this is a good area where if you're doing any of these higher level exercises where this is when it's really important to listen to your body. So don't start out by trying to do a full set, maybe do 1 or 2, see how it feels. If you notice anything off or any increase in pain, then definitely backing off and modifying what you're doing is going to be important.
So that let pain be your guide. That's a good rule of thumb. Okay.
Mm-hmm.
Connie Thompson, can we briefly touch on what are the best things to do when one has a sizable peristomal hernia?
Yeah, so going back to that hernia question, I think focusing a lot on your breathing and your breath. So exhaling. I have trained myself that anytime and I don't have a hernia, but anytime I get in and out of my car, I'm making sure that I exhale. Anytime that I'm doing anything, it's just automatic now. So really starting with the breathing exercises, there's kind of this trifecta. So working on breathing and decreasing pressure in your abdomen, strengthening your core or your foundational core muscles. And then, like I said, if a wrap or some sort of abdominal binder, they make specific abdominal binders that are for peristomal hernias. Those 3 can really be beneficial so that you can continue to exercise despite having a hernia.
Karen Calhoun, I had a wound vac post-op. The scar massage is okay to do at 9 months.
I would say generally yes, but again, if you are someone who had a wound vac, that probably indicates that there were some issues with wound healing. And so that's one where I would definitely defer to your medical team. So on a overall population level, I could say yes, but definitely knowing that there were some issues, following up with your team is going to be really important.
So what about if you haven't had any complications with healing necessarily that would require a wound vac, but you're like me and you're 10 years out post-op? Like, would scar massage still be beneficial for somebody that is 10 years out? And I've had several midline incisions. Would that still be helpful?
Yeah, absolutely. And especially at that point, all of your tissues are really intact. Things are obviously healed 10 years out, but you can absolutely still do scar massage, especially if you're feeling a lot of restriction in your scars or those areas. Just, yeah, working on that scar massage. And then, like I said, I didn't have time to touch on other soft tissue mobilization, but just looking into some of those um, techniques with therapists or trained professionals can be helpful because our tissues are very moldable and pliable. There is that ability to create change even years out from surgery.
That's amazing. Very cool. All right. Next question. Jen Small. Swimming is such an excellent, low impact, full body exercise that builds cardiovascular health. What are your recommendations for a new ostomy to swim? That's a great question.
It is. I agree. I think swimming is an excellent exercise. That one really is going to be, making sure that your incisions are healed, of course, before totally soaking or going in a pool. But swimming is a great way to move, especially if you're someone who has trouble exercising or difficulty with, joint pain or all those things. There should be no barrier to getting back to swimming after surgery, other than the healing aspect and being cleared to swim by your doctor.
Awesome. Julia Frax, what are some of the pros and cons of something like a stealth belt? How long post-op would you recommend integrating one? And I see there was another question about what a good appliance for swimming. So maybe we could kind of tie that into to the swimming question as well. So pros and cons of wearing something like a stealth belt or a binder even.
Yeah, I'm definitely not an expert on stealth belts. I do know what they are and I have used them in the past. Um, a stealth belt is more of a supportive belt, or a belt used to kind of conceal or provide discretion and a little bit more support. It's not necessarily something that's going to add the correct amount of pressure that a more like elastic hernia belt would offer. So I mean, really every belt, there are a lot of pros and cons depending on your body shape and size. I know a lot of women struggle with belts because they find with their hips that they just kind of ride up. So really choosing a belt or some sort of compressive garment is a very individual choice. I would say there's not necessarily cons other than I know some folks who wear belts find that it decreases the wear time of their ostomy appliance if there's some sort of like rubbing or it is causing, riding up. But then some people feel that that compression actually provides a longer wear time on their ostomy appliance. So again, it's very
So unique, yeah.
individualized. Yeah. And then going back to that question about something to wear during swimming, something like a stealth belt or other ostomy wrap or compression garment could definitely help provide support and concealment with swimming.
Yeah, I know some people use seals, which is a nice waterproof kind of tape that goes around. I just use medical tape, but I've never had any trouble with having it, come off during swimming. So awesome. Suzanne O'Connell Zanella, is yoga or chair yoga helpful? There was also a comment about Tai Chi too. What are your thoughts on yoga, Tai Chi, and chair yoga?
Yep, all of them. I mean, really any exercise that is meaningful or important to you is what's going to be helpful, because the exercise that you're motivated to do is the exercise that you're actually going to do. And so yoga or chair yoga is a great place to start for you. Then start with that. One thing you do want to think about is the poses, especially in yoga. Like, are they going to be increasing that pressure on your abdomen, and do you need to modify those poses? Especially any exercise that we talk about in terms of quadruped is a term you'll hear. So something where you're on like all fours and your abdomen's just kind of hanging down towards the floor. So like downward dog in yoga. At first, that just that hanging of your abdomen can be a lot of pressure. So those are things you'd probably want to modify at first and make sure that you have the support that you need before starting those exercises. So while those exercises can be foundational to really going back to that core and making sure that you feel support before getting into more challenging poses.
Mm-hmm. Pam Groff, could you give us a few more examples of when it's best to exhale as a certain motion? Thank you. Boy, I wish I would have known this very, very soon after my surgery, because I felt like I was so scared getting out of bed every time I had to get up because I didn't have the techniques to do that. So I know you said that that was one time when you're getting up out of a seated position, right, to exhale. Any other motions that you'd recommend?
If you're, just out of bed, if you're going to push yourself up to that sitting position, that's the time that I would even incorporate the exhale. It's really easy to just forget that we're even breathing. And this is why like eyes on you, or like having somebody that is your like spotter watching how you're moving can be helpful at first, because I'll talk to my patients about breathing. I'll talk through the techniques to decrease strain, and then I'll watch them do the movement and they'll just be like, and holding their breath, because they're trying to stabilize their core. And sometimes breath hold can be used for stability. But then with that cue to exhale, then that really decreases tension. So yeah, like pushing up out of bed, standing up from a chair, sitting in a chair, picking up anything off the ground or off of, even a countertop at first. The more that you think about exhaling when you're like lifting weight or doing anything that you perceive as an exerting activity, the more it becomes ingrained. So like for me, for example, I don't even have to think about exhaling. It's an automatic thing that I do anytime I'm standing up. And when I was doing my early rehabilitation myself after surgery, that's where I started doing it like an easy way that my PT would be like, okay, when you get up out of the car, just do it, because anytime you're doing those movements, it helps ingrain it into your muscle memory, or your ability to just remember that. So some good examples, like I said, picking up a laundry basket, once you can lift the gallon of milk after surgery, once you're pulling that gallon of milk out of the refrigerator, if you're doing yard work, if you're like, pushing the lawnmower, just making sure that you're breathing properly the whole time and you're not holding your breath. If you're picking up a child, basically any activity that you're doing that you feel like you're feeling tension in your abdomen. So anytime you feel tension, just do an exhale to let that tension go.
Good to know. All right, I think we have time for maybe a couple more questions. We'll do one or two more. Sylvia Keen, please talk about doing things to help prevent a peristomal hernia after surgery. I was told nothing about this type of hernia, and of course ended up with one. And maybe so also you could speak about prolapse too. I know CS has posted that. So anything about preventing peristomal hernias or even prolapse.
Yeah, basically everything we talked about today. It is unfortunate that that's not discussed as much after surgery. And I know part of it is, we don't want to have this fear factor that anytime we do anything that we're going to end up with these issues. So it is important to find that balance between thinking that everything you're going to do is going to cause harm versus knowing that you have the tools and you feel confident that you're doing the right thing to decrease your risk for these. Or like I said, even if you have a stoma, a prolapse, or a peristomal hernia, that you now have the tools to build from there and still do activity despite that. So like I said, the more that you can manage that pressure in your abdomen is really going to help. Wearing support garments if needed, and then just keeping your body moving and strong, because especially when you're living with a prolapse or a hernia, it can seem counterintuitive to want to do core exercises, because then you might, you kind of get down that path of thinking like, well, if I exercise, I'm just going to continue having this issue, or I'm just going to make it worse. But focusing on that core, that really deep core, is the best thing to help strengthen, because you need that strength in your core to help manage those symptoms.
Yeah, for sure. And I love what you said about, coming from a mindset of fear, but switching to something of empowerment, and you have tools that you can use. And so really focusing on the things that you can do to help and not be so afraid, which I know is easier said than done.
Right. Yeah.
Awesome. So just as a reminder, this is being recorded, so you guys can watch it at a later time if you need to. I think we're going to go ahead and wrap things up for now. I just want to thank you so much, Charlotte, for coming on tonight and giving us all of this amazing information to build strength and confidence after ostomy surgery. We really appreciate you joining us tonight. And then we'll definitely have in the links in the chat on how we can get a hold of you. If there's follow-up questions, I know if there's any other questions for me, I'll put my email in there and you guys can email me directly. But just wanted to thank you so much for joining us tonight.
Yeah, thank you for having me on. This is definitely my area of passion in life, and I really want everyone to feel as supported as they can after surgery. So I'm happy to get the information out there.
Well, we do feel supported and have learned a lot. Appreciate it. Thank you so much.
Thank you.
So viewers, if you, like I said, have any additional questions, you can email me directly at amylee.reese@ostomy.org. If you have any interest in topics for future Ostomy Academy programs, I'd love to hear from you. And to conclude tonight's program, I would love to welcome UOAA's Executive Director, Christine Ryan, to say a few closing remarks for us. Christine, welcome.
Hi.
Hey,
nice to see you all this evening. Yes, thank you for having me on this evening. And wow, what a great presentation that Charlotte put together. So thank you again very much, Charlotte, for a very informative hour on talking about this important subject. I just wanted to say a few closing comments before we said goodnight. As you may know, UOAA is a nonprofit organization, and we count on our donors to help us provide these free educational programs for the ostomy community. We also ship our free educational materials to people across the country. For example, we shipped out 12,000 plus new ostomy patients in 2022 alone. We also answered a little over 1,800 phone calls on our information line. So if you'd like to donate to help UOAA and the next ostomate who needs our services, you can easily donate on our website. Just click on Give Now on the ostomy.org website. I also wanted to mention that our 2023 Run for Resilience Ostomy 5Ks will be held again on October 7th and 14th in celebration of Ostomy Awareness Day. We're going to be holding one in Northwest Arkansas this year, and we're also looking at one in possibly Cincinnati. So more information about those runs will be coming on the website over the following months, so you can take a look at those and look for more information about those as we lead up to Ostomy Awareness Day. I also wanted to again remind everyone that our conference will be coming up in August. Go to our website, ostomy.org/2023 conference to learn more about the conference itself and our educational programs that we're going to be offering. You can also register there, and if you register by May 31st, you'll get the early bird rate, which is about a $15 savings. And finally, I just wanted to give a shout out to Amy Lee, to our communications and outreach and communications manager, Ed Fuller, to Steve Vandevender, who is our president-elect who worked on this, and all of our staffs who putting together this Ostomy Academy tonight. So thank you all for joining us tonight. It was nice to see you all, and we hope to see you in Houston in August. Thank you.
Bye, everyone. Have a great
Bye-bye.
night.
Have a good evening.